Good morning, students. Today we are going to discuss about the diseases of the external ear. Before going to the topic, everybody knows about the vast anatomy of the ear. So can be the components and can be divided into external, middle, and inner ear. So we'll start today's with external ear. So the diseases of external ear includes it can be a congenital deformities, acquired, and infections. Infections may be further classified into bacterial, fungal, and viral. So we'll start with congenital anomalies of the external ear. What are the general consideration about the anomaly of the external ear? It includes spectrum of malformation of the pinna as well as varying degrees of atresia and stenosis of external auditory canal. Congenital malformation of external ear is associated with abnormalities of middle and inner ear. What are the causes? It could be a disease of unknown etiology. So, as usual, disease associated with chromosomal abnormalities, diseases associated with Mendelian's inheritance, diseases associated with prenatal infection, diseases associated with maternal drug abuse, and it associated with also iatrogenic, maybe a phototoxicity. Lastly, but very important, environmental factors. We'll start with congenital deformity. It could be a microtia. What is microtia? Microtia is a small pinna. Lobe ear, stas ear, cryptosia, prominent ears, Mozart's ears. What is Mozart's ear? It is enlarged antihelix with helix both. Cyanosia, auricle placed posteriorly, maybe a cervical part of the neck. Melosia is auricle placed anteriorly, the cheek. Macrotia, anosia. Macrotia is a larger pinna, anosia is a absence of the pinna. So what could be the pathogenesis, pathology behind this? The multiple genes may have a role in outer ear formation, which can account for the phenotypically similar malformations. The sequence of such dysregulation is only beginning to be understood with the murine knock-out knock-in models. So, in the fetal development, the auricular hillocks that give rise to the pinna arises during the sixth week of embryogenesis, whereas the inner two-thirds of the external auditory canal are not formed until the 26th week. Untoward events throughout this period could give rise to the structural abnormalities or anomaly of the external ear only. How to prevent? Genetic counseling should be made available to parents who are known carriers of a genetic anomalies associated with external ear deformity. However, many anomalies of the external ear occur without known patterns of a genetic transformation. In these cases, genetic counseling opportunities are very limited. Some drugs may be the cause of this congenital deformities, and among the teratogens associated with anomalous hypoplasia of external ear and should be avoided during pregnancy. These are the some drugs should be avoided. Vincristine, colchicine, isotretinoin, cadmium, thalidomide. So all these drugs may be avoided. These pictures, it shows the called as a rudimentary tax or pre-auricular tax. So appendages, so extra growth in the tragus will be extra growth in the pre-auricular region. Small opening in the pre-auricular region we call it as a pre-auricular sinus. Microtia, otherwise called small ear or small pinna. These are some of the pictures shown in. And how can we divide this in a findings, clinical features? Can divide by a grade 1, grade 2. So we'll see the grade 1. So the mild deformity, dysmorphic helix and antihelix. What is lopier? Inferiorly angled positioning of the auricular cartilage. Cupped ear protrudes with a deep conchal ball. The conchal ball will be very deep. And set ear, low set ear. Then coming to the next variant, grade 2. All pinna structures are present. There will be no absence. All the parts of the pinna present. But tissue deficiency and significant deformity exist. Here, the classic grade 3, coming to the grade 3, little bit more higher variant, classic Microtia or Nausea or peanut ear. Small rudiment will be there. Few are no recognized landmarks of the auricle shown in the picture. And it can include anosmia. Anosmia is absence of pinna. What is the treatment of this congenital deformities? This deformity can be corrected with some plastic surgery box. Maybe stage 1 is auricular reconstruction. Stage 2 is lobe transposition. Stage 3 is post-auricular skin grafting. Stage 4 is a tracheal reconstruction and soft tissue rebulking. Maybe placement of processes, as seen in the picture, the beautiful girl before surgery, completely absence of pinna there. Then the second surgery is a very excellent work done by the surgeons, maybe a placement of processes. Then coming to the protruding ears. What are the features here? In the pictures, you can able to see the pinna is protruding like this. So an increase in distance from the helix to the mastoid is true to be due to the lack of antihelical fold. So absence of antihelix and prominence of the conchal bowel, and usually it may be bilateral. So how to treat this? We can treat by otoplasty. These are some of the pictures of the congenital deformities of the pinna. Then coming to the next stage, external auditory canal. In some conditions, the external auditory canal, which we all know about the shape, is a shaped canal, patent. In some condition may be patent, but narrow, along its whole length. What's the length of the canal? Anyone? Yes. Patent, some condition, narrow, the whole length. In some condition, patent but stenosed. We call it as a meatal stenosis. At the junction of its cartilaginous and bony part. So the whole length will be divided into two components, cartilaginous portion and bony portion. So maybe in between or at the junction of the cartilaginous and bony portion. Congenital atresia, that is closed over. It means absence. Completely the canal will be closed with a membranous or bony or maybe both. The both component will be close to each other. So throughout or across the canal. Here also we will divide it into some grades. What is grade 1? As usual, mild. Part of the external canal is present, although hypoplastic. The tympanic membrane is present but very small. What is the normal size of the tympanic membrane? 9 into 10 millimeters. It may be smaller but present. Grade 2 which we call as a moderate deficiency or moderate deformity, the external canal is completely absent. The tympanic membrane cavity, means tympanic cavity, is diminished in size, and the ossicles in the middle ear are deformed. The attic plate is partially ossified. So both, not only the external, middle ear also involved. Grade 3 we can call it as a severe deformity. The external canal is completely absent and the middle ear cavity is very smaller or shrunken or completely absent, and the attic plate is completely ossified. So both the components is totally ossified. Then coming to the atresia and stenosis of external auditory canal. What are the features, clinical findings, clinical features? It ranges from mild stenosis to complete atresia. It's associated with malformations of the pinna and the structures of the middle ear. What is the treatment of atresia and stenosis of external auditory canal? It's a reconstruction of oral atresia. Traumatic disorders of the external ear. It may be a physical injury. Physical injury to external ear structures occurs is very less common. Several anatomical structures protects the outer ear from injury. What are the structures? We'll see one by one. Blunt injury of the auricle. We call it as a seroma, collection of the fluid in the pinna or subperichondrial layer. It forms a fluctuant or tense collection, usually on lateral side of the auricle. Extravasation of serous fluid develops in between the cartilage and perichondrium. What is the etiology? Is a repeated trauma by scratching by their own fingers, nail buds, or repeated salt or something. So it may be developed. So in this, as shown in this picture, if a patient came with the first episode, then the treatment of choice is we'll start with the sterile aspiration of the fluid, evacuation, the total collection of the fluid outside. Then we'll give a compressive bandage, tight bandage to prevent and to develop further fluid collection. Then coming to the second stage, we call it as auricular haematoma. As the name itself, hematoma is the collection of blood and blood products there. It is a traumatic disruption of perichondrial blood vessels. Blood extravasates into perichondrial space, stripping the perichondrium away from the cartilage. If the cartilage is fractured, blood comes out. It seeps out through the fracture line and it extends to the subperichondrial plane of the opposite side, other side. As shown in this picture, you see the bulging of the pinna. So have a large hematoma there. So as shown in the second picture, aspiration of the fluid. So maybe a blunt trauma, etiology may be blunt trauma, or during boxers, repeated injury to the pinna. The features may be bluish or swollen, involving the both surfaces, but seroma only in the lateral surfaces. What is the treatment? Again, sterile aspiration. Blood may be drawn out using large bore needle. Otherwise, if you're going to use small needle, what will happen? The blood clot will blocks the tube, means the needle. And the lateral surfaces, over the lateral surfaces, we have to evacuate. And packed with Vaseline gauze and pressure bandage. It should be packed very tightly. If it is not there, if it is not helpful, then we have to open it and drainage. We call it as a incision and drainage, and we have to give a higher antibiotics. Short trauma of the auricle can call it as a laceration, aberration, avulsion of pinna, maybe animal and a human bite to the pinna, as shown in the picture. Some injuries maybe include thermal injury and injuries from cold. The cold and heat injuries of the auricle are in the same way similar, maybe the variation of degrees. Both may exhibit different degrees of severity, resulting in severe, reversible, or irreversible tissue damage and cell death. In burns, can divide it into 3 degrees. One is erythema formation, number 2 is blistering, number 3 is full thickness destruction. Again, it could be a electric burns, shock, thermal injury, acid burns, radiation injury. The cold injury may be we can call it as a frostbite. Maybe necrosis of the whole tissue, and blood supply will be cut off automatically. It will brittle and it will broken out. The treatment may be reverse cool compression or applications of cool ice pack should be there done. Oral anti-inflammatory, analgesics, antibiotics is the treatment of choice. Inflammatory conditions of the pinna. Sin Anthony's fire, erysipelas. The etiology is streptococcal hemolyticus. The features may include red, edematous, eruption with sharply defined edges associated with severe degree of malaise and temperature. So, treatment of course, antibiotics and anti-inflammatory treatment of choice. These are some of the pictures of St. Anthony's fire. Then coming to the very important is perichondritis. The inflammation of perichondrium covering the cartilage of the pinna and may follow trauma, leading to hematoma and infection. Clinical features includes enlargement of pinna, red, shiny, pain, fever, malaise, and body ache. The treatment is antibiotics, anti-inflammatory, local application of magnesium sulfate, and incision and drainage. Furunculosis is one of the bacterial infections of the external aortic canal, maybe in the hair follicles of the external aortic canal. The features may maybe a severe pain will be there, cruciating pain will be there, tracheal tenderness will be there. Some condition external aortic canal may be swollen. So it's very difficult to examine the canal. You're going to touch the pinna and push back, the patient will screams. Such a severe pain will be there. Then post-auricular sulcus is obliterated if infections spread posteriorly. And it could be involved in a lymph node enlargement, may be involved. So again, the treatment of choice is because of bacterial infection, you have to choose for antibiotics, and to reduce the pain and swelling, can go and give an anti-inflammatory. Then coming to the terminology, term like otitis externa. What is otitis externa? The infection or inflammation of the external ear, we can call it as a otitis externa. The etiology may be scratching with nails or objects, bathing and swimming in dirty pools. Excessive sweating changes the pH of the canal from acid to alkaline. The features, as usual, it includes pain, tenderness. Discharge may be serous or watery, and the swelling, edema will be there. And because of the inflammation, the condition, the appearance, the finding will be the redness over that. Again, the pain will be severe. If you're going to touch the pinna, the patient will give you a history of pain. Then the treatment is Again, because of the bacterial infection, antibiotics is treatment of choice to reduce the pain and swelling, so anti-inflammatory. Uh, Sometimes very useful the steroids cream with antibiotic soaked cotton wig maybe kept inside the canal and kept for 1 or 2 days. And after that you can remove. So topical application may be helpful for this kind of patients. Malignant otitis externa. One more condition, and this otitis externa, malignant otitis, these all the maybe asked you for a or short notes. It's very important. Malignant otitis externa, few points only. The causative etiology mostly by Pseudomonas. Pseudomonas especially seen in elderly diabetic patients. So 3 points you should note: elderly patients, aged person, diabetes, Pseudomonas. The features may be severe pain, excruciating pain will be there, so disturbed during night, and sometimes may or may not be facial nerve involvement will be there. Sometimes maybe paralysis will be there. The infection may spread to the skull base and jugular foramen, causing multiple cranial nerve patches. Very, very, very dangerous condition. That's why we call it as a malignant. The treatment is so control the diabetes, the first line of treatment. Two is IV antibiotics, heavy, I mean high antibiotics. Then local debridement, don't do violently. Gently, we have to remove the debridements. Only the debridements we can remove by suctioning or something from the necrotic tissue and bones to avoid further damage to the canal or tympanic membrane. Otomycosis. Otomycosis is otherwise called the fungal infection of the ear. Ear means an external canal. So it could be the causative organism could be aspergillus, a candida, maybe a niger. So depends upon the condition place. The features maybe starts with irritation, itching, and if it's going to be along with bacterial infection, it will turn into a pain, and sometimes watery ear discharge will be there. The treatment is because of the wet external canal. As usual, everybody knows the fungal infection, the fungus will goes in only in the wet medium. So to avoid this, we have to make it to dry. So before that, we have to suctionate all the automycotic debris from the external canal by suctioning or dry mopping or something, and put some antifungal drops or creams, and we can use gentian violet also. Coming to the viral now, herpes zoster oticus, Ramsay-Hunt syndrome, otherwise called. The etiology: herpes virus, varicella virus. So vesicles will be there. The findings: the vesicles will be there in the external canal, and pain will be there. Sometimes because of the viral involvement, maybe a hearing loss will be there. Mostly the hearing loss will be there, sensorineural hearing loss. Uh, and it can be associated with cranial nerves. So maybe a seventh nerve, fifth nerve, ninth nerve, and could be a 10th nerve also. Uh, because of some weakness, so multiple cranial nerve involvement will be there. So because of this multiple cranial nerve involvement, we have to treat very fast. If it is the viral, because this is the viral infection, so we have to give an antiviral, and to prevent the secondary complications with bacteria. So to prevent that, we have to give antibiotics to anti-inflammatory, and steroid plays a very important role here to reduce the edema, to reduce the virulence. So we have to give a steroids. It's a treatment. Now coming to the tumors of external ear. Sorry for the spelling mistake. External ear. We can call it as extostosis, adenoma, Malignant tumors may be a basal cell carcinoma, squamous cell carcinoma. So these are the tumors of external ear. Exososis is a bony growth in the external auditory canal. It's a bony overgrowth. So what will happen? So on examination of the tympanic membrane, try to examine the tympanic membrane, some mass-like structure will be blocking the tympanic membrane view, especially in the bony part of the external auditory canal. So we have to remove that. So we have to remove by during surgery. Um, this is one of the conditions. And miscellaneous condition may be a wax, maybe a impacted wax, uh, maybe a normal wax. So minimum 5 to 15% of wax should be prevented. Should not remove the wax. Only if you're going to remove the wax, only in condition totally obstructed the canal or causing ear blocking sensation, pain in the ear, then only we can remove. So excessive wax along with the bacterial infection, it may turn into keratosis obturans. It's one of the bacterial, one of the condition along with the wax formation with the bacterial infection. It will erode, it will damage the external auditory canal. Is the only condition we have to remove the keratosis by the short sleeve. So local removal is very difficult. The OPD is also very difficult because it's because of the cruciating pain will be there. Very painful condition. Then coming to the foreign body of the ear. So it may be a vegetative foreign body, non-vegetative foreign body, it could be a metal foreign body, whatever. Uh, Tell me one condition, how to remove the foreign body. We'll see in the next slides. What is wax? Ear canal produces a waxy oil called cerumen, which is more commonly known as earwax. This wax protects the ear from the dust, foreign particles, and microorganisms. When you clean your ears, you can accidentally push the wax deeper, causing complete blockage. Because of the shape of the canal, it starts with the broader and it goes circumcision. So all the wax will be blocked in the canal. So the wax buildups is a common reason for temporary hearing loss. So we have to remove the wax. As I already told about the keratosis operans, is the accumulation of desquamated keratinous material in the bony portion of the external canal. Patients with this condition typically present with severe pain because of the blockage in the ear, maybe conductive hearing loss temporarily. And if the global widening of the external auditory canal. Foreign bodies, as I told you before, vegetative and non-vegetative foreign body. In this picture, some cockroaches there, the canal, and the second picture, some rubber pellet is there in the canal. Removal of foreign body by using you can use by a suctioning or forceps or using some hooks you can remove the foreign body. But the only condition should not syringing. Which condition is a vegetative foreign body. So for example, some paddy field, some rice materials or something. If you're going to remove by using syringing, what will happen? It will swell. So if it is going to be swollen and completely blocks the canal, very difficult to remove the foreign body. So in that case, you should not remove the foreign body by suction, so by the syringing. You have to use by suctioning or hook or something. How to remove the foreign body? Live foreign body, live insect. To make it into anesthesia. So you can give some topical 4% xylocaine in the external canal. So make it non-mobilized and you can remove it smoothly. Or make it dead foreign body and then we can. Um, that's all about the diseases of external ear today's class. We'll go to the next class. We'll go to the other diseases. Hope I think you understand. If any doubt or any clarification, please free to call me at any time. I think I know everybody my number and email is there. You can call it. Okay. Thank you. Thank you so much. Thanks for listening.